Welcome, everyone, and thank you for joining us. If you are tuning in, I want to say thank you, whether you are a volunteer, a donor, or just somebody who's coming to learn a little bit more. We are going to be talking today about the effects of COVID-19 within Central Appalachia. If you're a volunteer with ASP, you know that our evening gatherings every evening of your week of service often focus on reflection, discussion, cultural awareness, and regional education. We wanted to be sure that even in the midst of our suspension of volunteer hosting, you are still aware of what's happening here in this area. Without our volunteers and supporters able to travel here, it is our hope today to bring you just a small glimpse into what life is like right now in the midst of COVID-19. Please know this is only a small sliver. We're only talking to a couple people today. This is obviously a very complex issue, and each different community has different needs about where they're heading. And if you have questions about a specific area, it's always best just to reach out to that specific area. But today we're actually going to chat with 4 different individuals, each an expert in their field, all coming together to talk about COVID-19. And together with all these different voices, hopefully we'll start to understand a little bit more about what life is really looking like in both urban and rural Appalachia. So we will chat with first Dr. Megan Quinn of ETSU's College of Public Health, as well as the Mayor of Johnson County, Tennessee, Mike Taylor. We'll chat with board member of Meadow River Valley Association and ASP member, he's a member of our Community Advisory Board, Dave Lumsden, as well as ASP's Executive Vice President, Melisa Miller. So we are talking with quite a few different people, and we're really excited to bring all those voices together. So to kick us off, why don't you all just take a couple minutes and just introduce yourself to everybody.
So my name is Megan Quinn. I'm an associate professor in the Department of Biostatistics and Epidemiology in the College of Public Health at East Tennessee State University. And so I participate with part of my time in the Center for Rural Health Research, as a little bit of my research time is dedicated to that. I'm also in the newly formed Strong Brain Institute at ETSU, which works on adverse childhood experiences and trauma-informed care. And I teach infectious disease epidemiology and field epidemiology. So the ways I'm kind of involved in COVID things that are going on in the community have a variety of different ways. So looking one at how, COVID has affected rural communities differently, maybe than urban communities or some of the hotspots we saw earlier on in the outbreak, which was an outbreak at one point, but is now a pandemic. And then also being involved with kind of staying in awareness of what's going on with the pandemic as I'm teaching that to my students. And so I co-teach with the medical director of the Northeast Regional Health Office, so got to learn a lot from Dr. David Kursky and his role, and then just making sure, we're staying abreast of the information that's going on and kind of understanding what's going on in terms of how this could be traumatic for people in a lot of different ways, and then also thinking of, how do we open things back up safely? How do we do that in a really conscious effort? So those are kind of the ways I'm involved.
Well, good afternoon. I'm Dave Lumsden. I'm on the Community Advisory Council for Appalachia Service Project. It's an honor to be able to do that, to maintain a contact with an organization that's made a huge difference in the Meadow River Valley. And let me shift gears just briefly and talk about the Meadow River Valley. It's a watershed. You won't find it on a map. But it's a collection of communities and all the wide spots in between that share common experiences. And we're working with an organization called the Meadow River Valley Association. I'm on that board to go ahead and change the outlook for the valley.
My name is Melisa Miller, and I'm Executive Vice President with Appalachia Service Project. We provide critical and emergency home repairs to those in need throughout Central Appalachia, working in 5 states, in Virginia, West Virginia, Kentucky, Tennessee, and North Carolina. So throughout the COVID-19 crisis, we have seen a variety of different things. The response varies in each of the states that we serve, and the infection rates are varying in each of the states and each of the counties that we serve. So it has been a moving target across the board for those who are living in the area, as well as for ASP, and what our response will be during this time.
Thank you all for joining us. I realized I didn't introduce myself. My name is Kara Nagy-Chattis. I'm going to give you these prompts and let our panelists talk through some of these issues together. I'm ASP's marketing and communication strategist, so you may have seen my face before in some different things like this, and I'll continue to be bringing you different activities throughout this summer and throughout this year while we all are apart to hopefully continue to stay connected and to continue to stay focused on the mission of ASP, even though we can't all be visiting Central Appalachia right now. Well, thank you again for all of the panelists for joining us as we discuss some of these effects of COVID-19 in your specific communities. We'll go ahead and dive into some questions here. We'll start with just how have you seen the needs of your community change since the rise of COVID-19? And will any of these changes be long-term? So Mike, actually, why don't we start with you?
I think in the beginning, the biggest change was the loss of jobs, and especially our local small business owners. They were probably hurt the most, the fastest. And so, a lot of people were really concerned about how they were going to support their families and how they were going to, keep their bills paid and keep their employees, keep them going forward too. So I think that was the biggest thing, was the economic downturn. I think scared people the most.
At ASP, we have not seen a decrease in the need for home repairs. The requests have not gone down. However, our ability to fulfill those requests has significantly decreased because we are unable to host volunteers coming from different states or within their own communities. We're not able to go inside people's homes at the moment, so we can't address any repairs on the interior of a home. So our staff is continuing to work as safely as we can, but we will likely this year serve about 350 less families than what we have in the past, specifically because of this crisis, and our requests continue to increase. Other issues that I have seen is that there's a lot of uncertainty about unemployment, about how long this crisis will continue to go on, and so that has caused some unrest, some stress on families, and especially those that are living in poor housing conditions are now confined at home more and more, which is decreasing their level of health as well as physically as well as mentally, and this is something that's difficult for us to be able to see.
Thank you all so much for your responses there. So how do you see some of these needs being resolved over time?
Sure. So I think a lot of people are trying to figure out how to do that best. So trying to be innovative and thinking through different ways that we can still work with people, even if it's maybe a slightly different scope of work, maybe a little bit outside of our comfort zone and what we're used to, but still being supportive of people, even if we have to be physically away from each other. And so I think that's some of the ways that things are changing over time. I think we'll see hopefully more people with internet access, even if that's through a Wi-Fi bus going to a space so that kids can get on the internet. And so I think there will be some changes like that occur. I also think that there will be a lot of people who recognize what's important and what they really value. So a lot of people have had the chance to stay home with their families and spend more time with their families because of working from home. And I think that's one thing in rural communities that people do a pretty good job of, but life gets pretty busy. And so just being able to recognize that when we go back to what normal was, maybe we can decide what really works for us as a community and as families and things like that, so that we can think about how we can incorporate positive health things into that new normal. So positive physical health and mental health and social supports and things like that. So I think we have a great opportunity to kind of reframe what that looks like after this. But right now, everybody's still kind of in crisis mode, so it's hard to think forward in that regard. So,
if we can continue to make progress towards a new normal, that'll help out a lot. Employment will recover a bit, but it's still going to be a problem. We're not going to have a normal economy for a couple of years. The state and federal and local feeding programs are maturing, as has the feeding programs from the nonprofit community. That will help with the food insecurity piece. Cohesiveness is still going to be a problem until we can get together at church, till we can get together in those shared meals, till we can get together and have community meetings. Doing social distancing and everything over Zoom is one way of getting things done, but it's not the preferred method. You still have to be able to meet people, to shake their hand, look them in the eye, and the rest of that. So it's going to be a slow progression back to normal.
So in what ways have you guys witnessed the resilience of your community?
Well, people who live in this area are generally accustomed to working hard. They're generally accustomed sometimes to hard times. And I think as a community, we're strong. And I think people have been very supportive of their neighbor. They've been very helpful to see that everyone has food and everyone is being taken care of. So I think that's some of the important pieces of living in a small rural community is that you know your neighbor and people yet look out for their neighbors.
So how can some people outside of the region support Appalachian communities right now?
Well, I've got a couple of thoughts on that. First, it'd be very good if folks would observe the protocols identified by their state and local and federal authorities so that they don't get contaminated, that they're not sick, so that when they travel into or through West Virginia, they're not bringing the virus with them. West Virginia has enjoyed a comparatively low infection rate. Having said that, having folks come from outside or having West Virginians go outside and bring it back with them, that's a real problem. So the first thing you could do is observe the protocols. But then the second thing that I'd suggest is that, and going back to our shared disaster recovery work, the nonprofit community and the community of faith are absolutely critical in seeing individuals and families and communities through tough times, through disasters. And those nonprofit organizations, the community of faith, are extraordinarily dependent on yours and mine largesse, our ability to go ahead and make a contribution, whether that's volunteer hours, whether that's dollars, whether that's in-kind support through material. So folks from outside, knowing that Appalachia needed assistance before the pandemic, should look hard at what they can do to increase their assistance while we continue to work through the pandemic.
Yeah, I think that's a great question. One of the things that has been positive in our area is that we, at least in Northeast Tennessee, we shut down a lot of things early. So we didn't have a lot of spread of COVID-19 in the early stages like I think we thought we would if we wouldn't have shut down. Now that things are a bit more open, people are traveling, and as much as we would love people to come to our area, just being really safe and responsible in doing that, because we do want to protect our citizens and be able to, again, provide those support services as much as we can on a normal basis. And if we keep having kind of both people who live here leaving and going on vacations and coming back and maybe not being as careful, and then people coming in, that could be problematic as that influx of people is changing. I think one of the ways that people can help is to understand that it's very place-based and how people have their own stories, and understanding those stories from people in Appalachia and specifically from their voice and their message. And so I think that's, one of the things that I do appreciate about ASP is you all do that a lot. So you really share the individual stories. And I know that's something at ETSU we try to do as well. So just thinking of that and thinking of really listening to people and letting them share their perspective and their piece of it. We have a lot of homegrown ideas, I guess you could call them. And so understanding that the solution needs to be specific to our community, and the solution needs to be specific to what people are interested in and what their ideas kind of foster. So even an idea that I come up with in Johnson City may not work in Mountain City because I'm not from there and I don't live there and I don't know that true story. So just recognizing and lifting up those voices of the people who are really on the ground doing the work and living in that community. So I think that would be one of the best ways. And of course, I mean, people have asked a couple of different questions like this, and donating and giving money to those organizations that are on the ground, I think always helps as well, even though a lot of us really like to be physically there to help out with that work, because the return on investment feels so much greater when you get to see the investment that you're doing. But right now, it's a lot safer to stay away and provide those donations, maybe in a monetary fashion or in the sense of raising awareness of the issues by using your voice or amplifying those other voices. So I think those are some of my thoughts on that.
Amazing. Thank you guys so much for joining us today and all of that insight. That is super helpful. We'll end with just an open-ended question. Is there anything else that you would want people to know about this topic or about your community in general right now?
As a faith-based organization, I think that is important for us to pray together for those outside the region, to connect with those inside the region. Let them know that you're thinking about them. Let them know that you're praying for them, and that we are still a nation and a community that can band together in difficult times, even from afar. Reaching out and know that there's community there is something that can go a long way.
Yeah, I think one of the things that I always think about with public health pandemics or something like COVID-19 is just to stay up to date on the real information coming from the local and state health departments and the Centers for Disease Control and Prevention and the National Institutes of Health. There's a lot of misinformation that can be passed around. And so going to those trusted sources and really recognizing what those are is helpful. And that's just one of those things that when you're trying to make a decision if you can go see your grandma again or not, knowing what's going on locally through your state health department is kind of key for that. So that would be my only other piece of information to add.
Well, thank you to all of our panelists for sharing, and for all of you who are tuning in to listen and learn. To close our time together, we're actually going to head out to West Virginia to hear from John Wyatt. John is a longtime friend of ASP. Many of you may have met him before. He's a singer-songwriter, and he has chosen to reflect on COVID-19 in his community through song. So, John, we're going to turn it over to you to close, and thank you guys all for joining in to us to chat about this today. John?
Well, the year was 2020 when I turned 21. Planned to go and see the world, then the virus come. Came and took my grandpa and my mama too. This world will be a sadder place if I turned 22. You came and took my family, you came and took my dreams. You came across the ocean, an enemy unseen. Corona-19 virus is what they now call you. The world will be a different place turned 22. You've shut down all our factories, shops, schools, and churches too. The pandemic, it's upon us, and we don't know what to do. Millions are without a job, they stand in bread lines too. This world will be a fearful place if I turn 22. But I remember Woody Guthrie and the songs he used to sing. We're all in this together, and we can beat this thing. We'll rise up from the ashes, this land is your land too. And we'll make this world a better place when I turn 22. This land is your land, this land is my land, from California